بسم الله الرحمن الرحيم. محاضرتنا لهذا اليوم في مادة الجنرال anatomy هي the face, and continue what related to the face is the muscle of facial expression. The muscles of face are embedded in the superficial fascia. Most arise from bone of the skull and are inserted into the skin of the face. It is function of facial muscle to serve as sphincters or dilator of this structure. A secondary function of facial muscle is to modify the expression of the face. أي شخص من خلال تعابير وجهه هي تعتمد على المسل of facial expression. The characteristic feature of the facial muscles. First, the primary function is expression of the emotion. The facial muscles are capable of performing 7,000 expressions according to Coleman. They are also responsible for the maintenance of the posture of the facial structure. The facial muscle also contributes to stabilization of mandible during the infantile swallowing and chewing and swallowing in the occlusally compromised adults. And last one, it is also important for the visual and the spoken communication. Slight information about the embryology of muscle of facial expression. Each pharyngeal arch consists of mesenchymal tissue covered on outside by surface ectoderm and on inside by epithelium of endodermal origin. The mesoderm of the arch give rise to musculature of the face and neck. Each arch is characterized by its own musculature and carry their own nerves. The muscles of facial expression, the auricular muscle, stylohyoid muscle, stapedius muscle, posterior belly of the gastric muscle originate from the second pharyngeal arch, the hyoid arch. The facial nerve, the nerve of the second arch, supply all the muscle of facial expression and muscle that mention it. This figure shows the most important that the first and second arch muscle of facial expression is from the second pharyngeal arch. We divide the muscle according to its opening. So we have orbital muscle, muscle of the eye, the ear muscle, muscle of the ear, and the mouth muscle, the upper and lower lip muscle, and the cheek and the nose. We start with the muscle of the eye. The muscle of the eye is origin in the upper and lower eyelid, so call it muscle of eyelid. We have two types of muscle, either muscle to open or muscle to close. So the muscle to close, call it sphincter muscles. The muscle to open is dilator muscle. The muscles of the eyelid is the sphincter muscle of eyelid is orbicularis oculi and corrugator supercilii. The dilator muscles are levator, the palpebrae superioris, and the occipitofrontalis muscle. We start with the orbicularis oculi. Has the three parts: the orbicularis oculi, orbital part, palpebral part, and lacrimal parts. The first part is the orbital part. As mentioned in this figure, its origin, each muscle has origin and insertion and innervation and its function. The origin of the orbital part of orbicularis oculi is from nasal component of frontal bone, frontal process of maxilla and middle palpebral ligament that in the side of the eye. The palpebral part is origin from medial palpebral ligament and bone above and below the ligament. The lacrimal part is origin from upper part of lacrimal crest and adjacent lateral surface of lacrimal bone. The three part is insertion within the skin around the margin and the orbit and the tarsal plate of upper and lower eyelid. These three figures, the orbital part, palpebral part, and lacrimal part, as A, B, C is mentioned in this figure. The vascular supply is a branch of facial nerve, superficial temporal branches of facial artery and vein, superficial temporal, maxillary, and ophthalmic artery that supply plus supply of the orbicularis oculi. Its innervation from two branch of facial nerve, the temporal and zygomatic branch of facial nerve. Its action, close eyelid, palpebral part gently close eyelid, but orbital part tightly closing the eyelid. Second muscle that related to the upper and lower eyelid is corrugator supercilii. Its origin from bone at the medial end of superciliary arch. Its insertion in the skin above the middle of the supraorbital margin. Its vascular supply from superficial and temporal and ophthalmic arteries. Its innervation from temporal branch of facial nerve. Its action with oculi muscle shield the eye involved in throwing vertical wrinkling of the forehead. The third muscle is not related to the muscle of facial expression, is related to the muscle of the orbit, is the levator palpebrae superioris. It is a feature, is triangular in shape. It arises its origin from lesser wing of sphenoid bone in front of optic foramen, but separated by a superior rectus muscle. The levator palpebrae superioris arises from undersurface of lesser wing of sphenoid bone in front of optic foramen and inserted in orbicularis oculi muscles, upper eyelid, and medial and lateral palpebral ligaments. The vascularity is blood supply from directly by ophthalmic artery or indirectly by supraorbital branch of ophthalmic artery. Nerve supply is from third cranial nerve, and there are sympathetic plexus around the third cranial nerve. Its action elevates upper eyelid, linked to superior rectus by cheek ligament, increased sympathetic activity, widening palpebral apparatus. Now, the second orifice is the nose. So the muscle of the nose and the nostril is the muscle of the nose is procerus. We have sphincter muscle is compressor neuraris, and dilator muscle is dilator neuraris. The nasal muscle group is procerus muscle. Its origin from facial aponeurosis covering lower part of the nasal bone and upper part of lateral nasal cartilage. Its insertion in the skin over lower part of the forehead between two eyebrows. Its vascular supply branch from facial artery. Its innervation from temporal and lower zygomatic branch of facial nerve. Its action, transverse wrinkles over the bridge of the nose help to reduce the glare of bright light. The second muscle is nasalis. It consists of transverse and alar parts. Transverse part from maxilla just lateral to the nasal notch. Alar part is origin from maxilla below and medial to the transverse parts. Insertion in the nasal cartilage. Its vascular supply, infraorbital branch of facial artery. Its innervation from buccal branch of facial nerve. Its action, transverse part, compress the nasal apparatus, and other part, widening the anterior and nasal apparatus, and both that deep insertions. The third muscle is depressor septi. Its origin from maxilla above the central incisor. Its insertion in mobile part of the nasal septum. Its supply plus supply from superior labial branch of facial artery. Its innervation from buccal branch of facial nerve. Its action pull the nasal septum downward with nasalis widening the nasal apparatus. The third orifice that have around the ear, called muscle of auricle, is elementary muscle. Small muscle have not a real action, not have appear within the auricle. They are divided into three muscles: the anterior, posterior, superior auricular muscle according to its position within the auricles. The other opening is the majority of our subject is muscle of the lip. We have two lips, upper and lower lip, and we have an opening that is led to the oral cavity. The R sphincter muscle is orbicularis oris, and we have a group of dilator muscle. The sphincter muscle is orbicularis oris that surrounds the upper and lower lip. Its origin and insertion: the fiber inserted the oral orifice within the substance of the lip. Some of the fiber arise near the midline from maxilla above and the mandible below. Other fiber arise from the deep surface of skin and pass obliquely to mucous membrane lining in inner surface of lip. Its insertion: many of fiber are derived from oxynotor muscles. The orbicularis oris compression of extrinsic and intrinsic part. We have divided into two parts. The extrinsic part consists of fiber of other muscle which convert to the lip. The intrinsic part within the lip consists three types of fiber: radiating, circular, and anterior-posterior fiber. The vascularity of the orbicularis muscle from superior and inferior labral branch of facial artery and mental infraorbital branch of maxillary artery and transverse facial branch of superficial temporal artery. Its innervation, buccal and middle branch of facial nerve. Its action: varying kind of movement of lip like putting, bruising, twisting. The dilator muscles of the lip. We have a group muscle that related to the upper and lower lip. The dilator muscle radiates out from the lip and their action to separate the lip. This movement is usually accompanied by separation of the jaw. So its action with the movement of the mandible in the opening or close the mouth. The muscle arises from the bone and facial around the oral apparatus and converging by inserted in the substance of the lip, traced from side of the nose to the angle of mouth and then below the oral apparatus. We have group of muscles that are related to the upper lip and to the lower lip. The muscles that related to the upper lip: levator labii superioris ligonesi, levator labii superioris, zygomatico minor, zygomatico major, levator anguli oris. The muscle that related to the lower lip: rhizoras, depressor anguli oris, depressor labii inferioris, and mentalis muscle. The first muscle that related to the upper lip: levator labii superioris ligonesi. Its origin from upper part of frontal process of maxilla. Its insertions: greater alar cartilage of the nose and skin over it, some fiber into lateral part of upper lip, and floor of dermis at the nasolabial furrow and ridge. So its insertion related to the nose and to the upper lip. The vascular supply: facial artery and infraorbital branch of maxillary artery. Innervation from zygomatic and buccal branch of facial nerve. Its action: rises and everts the upper lip, increase the curvature of top of nasolabial furrow, dilate the nostrils. Second muscle related to the upper lip is levator labii superioris. Its origin from maxilla and zygomatic bone above the infraorbital foramen. Its insertion in a muscular substance of upper lip. Its blood supply: facial artery and infraorbital branch of maxillary artery. Its innervation from zygomatic and buccal branch of facial nerve. Its action elevate and invert the upper lip, modified the nasolabial furrow. The third muscle is zygomatico major. Its origin from the zygomatic bone just in front of the zygomatico-temporal suture. Its insertion at the angle of mouth. Its blood supply superior labial branch of facial artery. Its innervation from the zygomatic and buccal branch of facial nerve. Its action draws the angle of the mouth upward and laterally as in laughing. The fourth muscle is zygomatico minor. Its origin from lateral surface of the zygomatic bone beyond the zygomatico-maxillary suture. Its insertion in muscular substance of upper lip. Its blood supply superior labial branch of facial artery. Its innervation from the zygomatic and buccal branch of facial nerve. Its action elevates the upper lip, exposing the maxillary teeth, bending, deepening, and elevating nasolabial hollow, crural, and the upper lip in smiling content. The last muscle related to the upper lip is Levator anguli oris. Its origin from canine fossa of maxilla. Its insertion into the below the angle of the mouth. Its vascular supply superior labial branch of facial artery and infraorbital branch of maxillary artery. Its innervation from zygomatic and buccal branch of facial nerve. Its action rises the angle of mouth in smiling depth and contour of nasolabial furrow. The muscle that related to the mandible, the first muscle, is called mentalis. Its origin is the fossa of the mandible. Its insertion in the skin of the chin. Its vascular supply inferior labial branch of facial and mental branch of maxillary artery. Its innervation from mandibular branch of facial nerve. Its action rises the lower lip, wrinkling the chin of the skin, help in drinking, and its expression as adopt. The second muscle that related to the mandible is Depressor labii inferioris. Its origin oblique line of mandibular between the symphysis and thigh and mental foramen. Its insertion into the skin and mucosa of lower lip. Its vascular supply inferior labial branch of facial artery and ventral branch of maxillary artery. Its innervation from mandibular branch of facial nerve. Its action draws the lower lip downward and little laterally and assists in inversion of lower lip. Its expression irony face, sorrow, and doubts. The other muscle that related to the mandible, the Depressor anguli oris. Its origin from mental tubercle of mandible and its continuation the oblique line deep to the labii inferioris. Its insertion at the angle of the mouth. Its vascular supply inferior labial branch of facial artery and mental branch of maxillary artery. Its innervation buccal and mandibular branch of facial nerve. Its action draw the angle of mouth downward and laterally in opening mouth and expressing sadness, like the patient is sad condition. The other muscle is rhizoras, or called grinning muscles. Its origin from fascia covering the parotid gland. Its insertion skin mucous membrane of angle of mouth and the Orbicularis oris. Its vascular supply superior labial branch of facial artery. Its innervation buccal branch of facial nerve. Its action pull the corner of mouth laterally, grinning and laughing. The muscle that related to the cheek, called it muscle of the cheek, is only one muscle, is occipitator muscle. Its origin from outer surface of alveolar margin of maxilla and mandible opposite the molar teeth and from the pterygomandibular ligament. Its insertion The muscle fiber passes forward, forming muscle layer of the cheek. The muscle is pressed by parotid duct. At the angle of mouth, the central fiber decusses those from below entering the upper lip and nose from above entering the lower lip. The highest and lowest fiber continue into upper and lower lip respectively without intersecting. The occipital muscle lost length and form part of the orbicularis oris muscle. So, the occipital muscle or whistling muscle, its origin we have divided to upper fiber and lower fiber. The upper fiber from outer surface of the process of upper molar teeth, lower fiber from corresponding area of mandible, and the last part is called middle fiber from trigomandibular labii. So we have three origin fibers: the upper, lower, and middle fibers. The insertion: the upper fiber into upper lip, lower fiber into lower lip, and the upper of middle fiber cross the angle of mouth or to run into lower lip, and lower of this fiber similarly run into upper lip. Its vascular supply: facial and buccal branch of maxillary artery. Innervation: buccal branch of facial nerve. Its action: compresses the cheek, aging the teeth and gum during mastication, and assists the tongue in directing food below the teeth. There are other muscles that related to the lips. It's called modulus muscle. In the facial anatomy, the modulus is chiasma of facial muscle, held together by fibrous tissue, located laterally and slightly superior to each angle of mouth. This is important in moving the mouth, facial expression, and dentistry. It derives its motor nerve supply from facial nerve, and its blood supply from labial branch of facial artery. Is contributed to by the following muscle. It is related to the other muscle of the facial expression. This muscle, Orbicularis oris, buccinator, Levator anguli oris, Depressor anguli oris, Zygomatic major, Rhizoras quadrant, labial superioris, and quadrant labii inferioris. The muscle that related to the neck but is related to the lower lip is latissimus muscle. Its origin: upper part of the pectoral and deltoid fascia. Fibers run upward and medially. Its insertion: anterior fiber to the base of the mantle, posterior fiber to the skin of the lower face and lip, and may be continuous with the rhizoras. Its innervation in the cervical branch of facial nerve. Its action: release the pressure of skin on the subject vein, depress mandible, pull the angle of the mouth downward as in horror or surprise. So we summarize the function of the muscle of facial expression into this opening, sphincter, and dilator. The opening muscle into the palpebral fissure is orbicularis oculi, that related to the eye. The dilator muscle, Levator palpebrae superioris, frontalis part of occipitofrontalis muscle that related to the skull. The second opening is nostrils, that related to the nose. Is sphincter muscle, compressor nares, is dilator muscles, dilator nares, Levator labii superioris, erigonesi, and depressor septi. The oral fissure that related to the mouth, the sphincter muscle, orbicularis oris, and dilator muscle, all muscle around the mouth, except orbicularis oris and mentalis muscle. This figure shows the expression, and that أشكال that related to muscle of facial expression: السعيد، الساخر، البائس، المروع، المذعور، مراوغ، مخادع، شيطاني، مندهش، مرهق, and بريء. There are many facial expressions like the ease, happy or amused, laughter, the anger, the hot, the aggressive, the sad, the bored, and the mild. This is all expression that have done by muscle of facial expression. The nervation of the all muscle of facial expression by the facial nerve. The facial nerve is seventh cranial nerve of pair of cranial nerve. There are 12 pairs of cranial nerve. The seventh one is the facial nerve. Its course emerges from brainstem between the bonus and the medulla oblongata and control the muscle of facial expression and function in the conveyance of taste sensation from the anterior two-thirds of the tongue and oral cavity. Also supply pre-ganglionic parasympathetic fiber to the cerebral head and main ganglia. The motor part of facial nerve arises from facial nervous muscle nuclei in the bonus, while the sensory part of the facial nerve arises from the nervus intermedius. سابقا يعتبر pure motor nerve، ولكن بعد اكتشاف a small branch of the roots of the sensory that is carried by nervus intermedius، فلهذا أصبح الفيشل nerve mixed nerve. The anatomy of facial nerve branches. The facial nerve exists the posterior cranial fossa at the internal acoustic meatus. From internal acoustic meatus, that within the internal acoustic meatus, the facial nerve enters the facial canal within the internal ear. The first branch of facial nerve, the greater superficial dorsal nerve, branches from the ganglion within the geno of the facial canal and enter the middle cranial fossa by way of hiatus of the canal for greater spinal superficial petrosal nerve. The second branch of facial nerve, the stapedial nerve, branches from the descending portion of facial nerve and enter the middle ear. The third branch of facial nerve, the chordotympani nerve, branches from the descending portion of facial nerve and enter the middle ear. Within the middle ear, the chordotympani nerve crosses the medial surface of the tympanic membrane and then passes through the pterygotympanic fissure to enter the infratemporal fossa. The descending portion of facial nerve continues into the parotid region by the way of stylomastoid foramen that exit from the middle ear to the external ear to the outside of the skull by the stylomastoid foramen that go to the posterior surface of parotid glands. The motor and sensory part of facial nerve enter the temporal bone via the internal auditory meatus and intimately close the inner ear, emerge from stylomastoid foramen and pass through the parotid gland where it divided into 5 major branches through its pass through the parotid gland. The facial nerve from the ganglion prior to enter the facial canal. The red arrow, the facial nerve exists the posterior cranial fossa as the internal acoustic meatus. The arrow within the internal acoustic meatus, the facial nerve enters the facial canal. The arrows, the first branch of facial nerve, the greater superficial petrosal nerve, branch from the geniculate ganglia within the genus of facial canal and enter the middle cranial fossa by way of hiatus of the canal for greater superficial petrosal nerve. The arrow, the second branch of facial nerve, the stapedius nerve branch from the descending portion of facial nerve and enter the middle ear. The arrow, the third branch of facial nerve, the chordotympani nerve, branch from the descending portion of facial nerve and enter the middle ear. Within the middle ear, the chordotympani nerve crosses the medial surface of tympanic membrane and then passes through the pterygotympanic fissure to enter the infratemporal fossa. The arrow, The descending portion of the facial nerve exits the facial canal at the zygomatic foramen and continue to the parotid region in the gland. The branching inside the skull, there are greater petrosal nerve, provide parasympathetic innervation to the lacrimal gland, sphenoid sinuses, frontal sinuses, maxillary sinuses, ethmoidal sinuses, to the nasal cavity, as well as special sensory taste fiber to palatal via the nerve. The secondary branch, nerve to stapedius, that provide motor innervation of stapedius muscle in middle ear. The third branch, chorda tympani, supply the submammary gland, sublingual gland, special sensory taste fiber for anterior two-thirds of the tongue. Outside of the skull, through the distal to stylomastoid foramen, the following nerve branch of the facial nerve. Posterior auricular nerve control movement of some of the skull muscle around the ear. Branch of posterior villi of the gastric and stylomastoid muscle. 5 major branch in the side the parotid gland from top to the bottom. Temporal branch, auricle and front occipital muscle. Zygomatic branch, supply muscle of the zygomatic arch and orbit. The buccal branch, supply muscle in cheek and above the mouth. Marginal mandibular branch, supply muscle in the region of the mandible. Cervical branch, supply the platysmus muscle. This is the branches of the facial nerve that have within the skull and outside of the skull within the parotid gland. The enter through the ear through the internal acoustic meatus and give branch to muscular motor muscle of the facial nerve, posterior auricular branch, and stylomastoid through the stylomastoid foramen. We can draw the terminal branch through your hand, put the thumb downward, and the course of the 5 branch by your fingers. The first one, upper one, is temporalis, the second one zygomatic, and then one buccal, and the fourth one mandibular, and the last one cervical branch in the neck. The branches of facial nerve within the parotid gland, the temporal branch emerge from the upper border of the gland and supply the anterior and superior auricular muscle, the frontal villi of the occipitofrontalis muscles, the orbicularis oculi, and corrugator supercilii. The second branch, the zygomatic branch, emerge from the anterior border of gland and supply the orbicularis oculi. The third branch, the buccal branch, emerge from the anterior border of the gland below the parotid duct and supply the proximal muscle and the muscle of the upper lip and nostril. The fourth branch, the mandibular branch, emerge from the anterior border of the gland and supply the muscle of lower lip. The last branch, cervical branch, emerge from lower border of the parotid gland and pass forward in the neck below the mandible to supply the platysmus muscle. The function of the facial nerve, we have efferent, and this efferent, its main function is motor control of most of muscle of facial expression. It's also innervate the posterior villi of the gastric muscle, styloid muscle, and stapedius muscle of middle ear. The facial also supply parasympathetic fiber to submandibular gland, sublingual gland, and conduit by chorda tympani. Parasympathetic innervation serve to increase the flow of saliva from these glands. It also supplies parasympathetic innervation to the nasal mucosa and lacrimal gland and pterygopalatine ganglion. The facial nerve also functions as the efferent limb of cortex reflex. The efferent function, in addition to its received taste sensation from anterior two-thirds of the tongue via the chorda tympani, taste sensation is sent to gustatory portion of solitary nuclei. Another sensation from anterior two-thirds of the tongue are supplied by efferent fiber of the third division of the fifth cranial nerve, the trigeminal nerve. This sensory of the mandibular division of trigeminal nerve and the taste fiber of the facial nerve travel together as lingual nerve peripherally before the chorda tympani leave the lingual nerve to enter the tympanic cavity. within the middle ear via the pterygotympanic fissure. It thus joins the rest of facial neck via canaliculus for chordae tympani. Facial nerve then meet the geniculate ganglia, sensory ganglia of the taste fiber of the chordae tympani and other taste pathways. From geniculate ganglia, the taste fiber continue as the intermediate nervus, which goes to the upper anterior quadrant of fundus of internal acoustic meatus, along with the motor route of facial nerve. The intermediate nerve reaches the posterior cranial fossa via the internal acoustic meatus before the synapses in the solitary nuclei. The cell body of the chordae tympani rests in the geniculate ganglia, and there's parasympathetic fiber synapse in the submental ganglia attached to the lingual nerve. The facial nerve also supplies a small amount of afferent innervation to the oropharynx below the palatine tonsil. There are also small amount of the cutaneous sensation carried by nervous intermediates from the skin and along the auricle as an air loop. Thank you for your listening. A man's face is his autobiography within your feature. So, with great thank you for your attention. Any question later.